So I think we'll get started. I don't know if anybody else will trickle in, but wanted to introduce myself. I'm Dr. Tim Canan. I'm one of the interventional cardiologists with UCLA. I work primarily out of the Ventura office. There's a clinic over there on Telephone Road over there, but I work on the inpatient side of things as well. If anybody or family members end up in the hospital, from Community Memorial in Ventura to St. John's in Oxnard to St. John's right behind here, and then do some procedures at Thousand Oaks and Simi Valley as well as Westwood. So I'm a little bit all over the place, but I'm primarily in Ventura to Camarillo sort of area. So I wanted to talk today about something that I think will be applicable to really everybody, hopefully from recommendations from little kids all the way up to seniors, and it's talking about the exercise guidelines. They released some new guidelines in 2018, an update to the ones from 2008. So I want to just kind of talk about some of the recommendations for activity, physical activity, and then as a second topic at the end, I wanted to talk a little bit about monitoring heart rate with activity and some of the ways that we can help guide our exercise with heart rate data that's becoming more prevalent these days with some of the wearable technology. So just as a disclosure, I don't have any direct significant financial interests, and I will talk about specific products as examples, and I don't specifically endorse, or UCLA doesn't endorse any specific products. These are just examples for what is available out there. So the problem out there is that there is a lot of physical inactivity and sedentary behavior, and there's an estimation that 10% of premature death and up to $117 billion in annual health care costs every year are associated with inactivity and inadequate physical activity. So the vast majority of of Americans do not meet the recommended guidelines, and the trends for sedentary behavior are just kind of getting worse, especially in children and adolescents, but also in adults. People are spending more time on their computer, and by computer I also mean phone and tablet. It's not just a desktop these days, but people are sitting more and doing less. So this is a trend for the percent of people who meet the guidelines. If you look at the numbers over here, women on the bottom, men on top. Women started about 15%, men not much better at about 20-something percent in 2008 with the first guidelines, and it's gotten slightly better, but still in that sort of 25% range of what people are meeting the guidelines.
Are these the new guidelines you're going to be discussing?
Yes, these are the initial ones were in 2008, and then the updated ones from 2018. So this data is from the prior guidelines, but over the last 10 years, yeah. So just a couple trends. Watching television, this is in hours per day. So people who watch the TV greater than or equal to 2 hours per day, 3 or even 4 hours per day is a significant amount. The trend is relatively flat, but 65% or so of people, of adults over age 20 are watching more than 2 hours of TV a day. Computer use, home not including for work or school, has been increasing over the last 10 years. So I want to talk about some of the benefits of physical activity. Yeah.
Could I just ask, in terms of sedentary behavior, watching TV, how is that any different from sitting and reading a book?
Well, in terms of sedentary behavior,
Yeah,
it's not. It's the same thing.
Anyway, I was just curious. It's the same thing.
Yeah. In terms of activity level, those two are equivalent, yeah. So there are a vast number of benefits of physical activity, and it's not just what we normally think of, the kind of fitness and weight loss that is included of it, but cardiovascular benefits, decreased heart attack, decreased stroke, decreased incidence of type 2 diabetes, lowers your blood pressure, lower cholesterol levels. It raises your good cholesterol, the HDL. decrease in, this is a little bit, there's some nuance to this, decreased weight gain, not necessarily weight loss, but it does help with weight loss when you combine it with reduced calorie intake, with diet. So dieting is still going to be more important and very significant in terms of cutting calories and losing weight, but exercise will help with that and help you maintain that weight loss if you have achieved it. And then all of these things together basically combine into a decreased rate of cardiovascular death, one of the things that we're obviously interested in and concerned about. So specifically with the brain, decreases the risk of stroke, we mentioned, but also increase in cognition, better sleep, decrease in anxiety and depression, and decreased risk of dementia and specifically Alzheimer's disease. So you have all of these neurocognitive benefits as well. There have been associations with a number of different types of cancers and decreasing the risk of getting these types of cancers, of breast, colon, lung, endometrial cancer, bladder cancer, esophagus, stomach, and kidneys. So this one is not as obvious, but we have seen these benefits with exercise. Kind of general health benefits. These, I think, relate especially to the elderly. If you're getting into 80s and 90s, bone health and your physical function and your quality of life becomes more and more important, and especially decreasing the risk of falls. So we'll talk about some of the recommendations that are in the guidelines for the elderly, and how we can decrease falls. And then if you do fall, you have a lower risk of actually injuring yourself in that fall, so fall-related injuries. Quality of life, and then again, just decreased mortality, decreased death with following the exercise guidelines. During pregnancy, decrease in excessive weight gain, decrease in the risk of gestational diabetes, and decrease in postpartum depression as well. And then the new guidelines, this is one of the updates in the 2018 guidelines, is that they added some data or some recommendations from new data that was obtained from children and adolescents that have been studied. So even starting as early as age 3, we have data that keeping them active, and I'll talk about how much that is, keeping them active will improve their bone health, improve their weight status. We have childhood obesity that's starting very early these days, improving their fitness, and then decreasing the risk of depression, even in kids, and increasing their cognitive abilities. So these similar type of neurocognitive benefits that we see in the elderly, we also see in children as young as 3 or 6 years old. And so the question that we'll get to now is, what does this mean? What are these guidelines? What should I be doing? And this would be great if everybody could run Boston Marathon, but that's not actually necessary. And we'll talk about the specifics of the guidelines, that we don't need to be doing multi-hour endurance events to really get a significant benefit from physical activity. So this is more like what we can do to improve our health. We live in a beautiful area. We can go walk on the beach in Ventura or Oxnard Shores, and this will actually give us quite a bit of benefit in itself. Okay? So the specifics of the 2018 guidelines. So the first thing that I want to say is that these are the physical activity guidelines, not the exercise guidelines. So physical activity is really anything that requires energy. We're talking about doing household chores, doing shopping, doing stretching exercises, yoga, tai chi, all these types of things. It's not just quote-unquote exercise, okay? The guidelines talk about a couple specific types of activities, one of which is muscle strengthening exercises. And this is recommended basically for all ages, doing some resistance training, doing some weightlifting possibly. But you don't have to lift barbells. This can include using elastic bands or even just your own body weight as resistance to help strengthen the muscles. decrease the risk of falls, fall-related injuries, and keep up your strength. Bone strengthening activities, this is recommended as well, especially in children. Any kind of bone strengthening activity is a weight-bearing activity. So walking, jogging, running, where you're having an impact with the ground. So this would not include stuff like swimming or cycling, where you don't have that impact. You're not, it's not a weight-bearing activity. It's still beneficial, but it's not specifically a bone strengthening activity. And finally, balance activities. Activities, especially in the elderly, that reduce the risk of falls, including yoga, stretching, and muscle strengthening of the core muscles to keep us upright where we should be. Now, aerobic activity. So this is we would call an endurance or a cardio type of activity, which is a repetitive movement for a sustained period of time that increases your heart rate, increases your respiratory rate, makes you sweat a little bit. So this is an aerobic activity. And the three components of that they discuss in the guidelines are the duration, the intensity, and the frequency of the exercise. So the duration, meaning how long you do it for. The frequency is how many days a week you do it. And then the intensity, we'll get into a little bit more detail on what that means. So the intensity, how hard you're working out or how hard your activity is, can be described in a couple different ways. So the first one is what we call the absolute intensity. So we have to have some sort of quantitative scale on how difficult something is, how much energy you're using. And to do that, we can compare it to what we call the resting metabolic rate. So this is 1 MET, or the metabolic equivalent of task, is the amount of energy that your body expends by sitting there and maybe watching TV. So doing absolutely nothing. Reading is actually slightly more than 1 MET. I think it's like 1.1 because it takes a little bit of energy in your brain to process the information, and you have to turn pages. So unless you're on
a computer game on your phone.
So it's probably about 1.1 or something like that. Yeah. So, 1 MET is basically sleeping, having absolutely no activity. Anything else, even reading, even doing some sort of movement of the arms will have slightly more. But obviously we want to get a little bit higher than 1.1. The other way to think about intensity is something called relative intensity. So we can put things on a scale from 1 to 10, and this is going to differ for every individual. So compared to your maximum capacity, your absolute maximum effort, where does this activity range on your scale? And this gets into descriptive terms more like light, moderate, somewhat hard, or hard activity. And you can kind of judge it on a 1 to 10 scale, where 10 is you're on a full-out sprint, and then 1 is your resting metabolic rate, your resting activity. So we'll talk about where these cutoffs are in terms of the absolute and relative intensity. Any questions so far? We will have some more question time at the end, but just wanted to. Okay. Yeah.
Can you find this online? Everything, the new guidelines for 2018?
Yeah.
Okay.
Yeah.
I think it's difficult for people who retire, because when I was working, my particular job, I was walking, I was on my feet, I was moving for hours every day, and now it's more difficult to engage in that kind of activity. I mean, you have bursts of different things that you do, but it's I don't know, it's different.
Yeah, no, you're absolutely right, and that's kind of the difference between physical activity and exercise. If we're in a fairly active job, if I'm on rounds at 3 different hospitals and walking around the rounds and going up and down stairs, I'm doing a lot of physical activity during my normal workday that's I wouldn't necessarily call exercise, but I am getting more benefit from doing that compared to if I'm just sitting on the computer and typing notes, which unfortunately I also have to do quite a bit in my job these days. But you're absolutely right. And after we finish working, you have to find new ways to stay active and keep ourselves healthy. Yeah. So this I kind of already mentioned. We'll kind of go through the different intensity levels. So resting has an absolute intensity of 1 MET, 1.0, and this is sitting or lying down watching TV. A low intensity activity has an absolute intensity of less than 4 metabolic equivalents. In relative intensity, this would be something fairly light that you're doing, and this can include walking slowly, less than 2 miles per hour, doing light household chores, stretching, yoga, some of these things that we've kind of been mentioning. These are all better than sitting and watching TV, but this is a light intensity, less than 4 METs. Where we really get into the benefit is if we start doing moderate intensity. And this is really what the numbers that the guidelines are going for is going for these moderate intensity workouts from about 4 to 6 METs. And in terms of relative intensity, what you feel, your intuition, you feel that it's somewhat hard to do that activity. So this would be brisk walking, cycling maybe on a cruiser bike at a kind of a leisurely pace, or cycling to work. And then a lot of actually manual labor jobs and like such as yard work, that actually pushes your activities into this moderate pace where you're doing 4 to 6 metabolic equivalents just doing your job. So this is all included in kind of moderate intensity. And then we get up to vigorous intensity, which is anything kind of more than that. So greater than 6 METs. And in terms of relative intensity, you're working hard. So on a scale of 1 to 10, this would be a 7, 8, 9, or flat out 10. So this would be jogging or running, cycling at least a moderate effort, and then rowing. And then in terms of normal work, if you are carrying groceries or carrying something that's more than about 25 pounds upstairs, that's a pretty significant effort. Can you imagine carrying something upstairs for 20 minutes? That would be a lot of stairs. That'd be really hard to do. So that would be obviously a vigorous intensity in effort. Okay, so the guidelines, the specific numbers. This is really the key in the guidelines. These are the numbers that we're trying to get to. So for substantial health benefits, adults should do at least 150 to 300 minutes per week of moderate intensity, or if you can do vigorous intensity, you get a little bit more bang for your buck, and you can do a little bit less of it and still get that benefit. So about 75 to 150 minutes per week, or some sort of combination of the two. So this averages out, if we spread it out evenly throughout the week, which is ideal, averages out to about 30 to 60 minutes per day of moderate intensity, or 15 to 30 minutes per day of vigorous intensity for at least 5 days out of the week. So this would be how we could get to that goal. Okay. In addition to that, the guidelines recommend some form of muscle strengthening, some resistance work, either with your body weight or resistance bands or exercise or weightlifting, of all the major muscle groups on 2 days or more per week. Okay, so here's a combination of the aerobic exercise as well as the muscle strengthening, and that. So in total, we want to be working out at least 5 days a week, doing some sort of at least moderate intensity, brisk walking or something similar, 5 days a week for at least a half an hour. Okay, and there's really we haven't found a definitive limit. If you're doing more than this, you'll continue to get additional benefits if you're able to, if you have time to do more than this. That's the limiting factor, I think, for a lot of us. Okay? So in general, as a one-liner, the guidelines say move more and sit less. Okay? The previous recommendations, one of the changes that this made from the 2008 guidelines is that before you had to do these exercises in episodes or sessions that lasted at least 10 minutes for them to count. So, what I mentioned before, the carrying the groceries up the stairs, if you weren't carrying those groceries up for at least 10 minutes, they didn't count. And we kind of threw that out. We found that, move more, sit less. We found that any type of activity that you're doing is going to benefit you and is going to count towards these guidelines. It's a little bit harder to keep track of if you're doing small efforts, but they do help. And so that statement was removed in the new guidelines. And so this is kind of what I said. Reducing sedentary time for any amount of activity will result in health benefits, and small changes in lifestyle can add up and lead to benefits in the long run. So that includes, if you have the option here, taking the stairs instead of the short escalator flight, or if you're going shopping, parking a little bit farther away. So get a little bit extra walk as you're going into the store. All of these little efforts, these little lifestyle changes will add up, will build your strength, and benefit you for all those reasons that we talked about at the beginning. Okay? So as you get into these exercises and are able to do more and more, your body will adapt. And so we recommend that you gradually increase your efforts by small amounts. So this can include increasing the duration, doing it for a little bit longer, increasing the intensity on the moderate to vigorous scale that we talked about, and then increasing the number of days per week. If you start at only being able to do 2 days a week, going up to 3 to 4 to 5 to meet those recommendations. And a health professional or a physical activity specialist can help to sort of individualize these goals to make them reachable for the individual, depending on all the other factors going on in your life and other medical conditions. Okay? So for older adults, which they define as 65 or older, all the previous recommendations basically apply as well. And the key, again, is to move more and sit less. Specifically, they recommend some multi-component activities that includes some balance training, includes aerobic exercise, and includes muscle strengthening. And this is mostly to keep up core strength, keep your balance up, to reduce the risk of falls. The mortality rate for a hip fracture is extremely high. A number I've heard is 50%. And it's not because of the broken bone, it's because of all the complications afterwards. You're in the hospital, you get an infection in the hospital, you get pneumonia, you can't walk, so you get sedentary, you maybe get a blood clot. There's all these other sort of factors that come in, so the less we can fall and injure ourselves falling, that's how we stay alive longer. Okay? And that's comes into the mortality benefit of these activities. So older adults should look at your own activity levels and the level of effort for physical activity relative to your fitness and other medical conditions. And those with chronic conditions should look at the safety of exercise, and this is really where a healthcare professional can help out, your geriatrician or a cardiologist, to look at what is safe. So they specifically say in the guidelines, if you can't get to that 150 minutes per week of moderate intensity exercise due to your chronic conditions, you should be as physically active as possible. Even if you can't get to that 150, you still will benefit by doing as much as you can and staying as active as possible. During pregnancy, I mentioned some of the benefits during pregnancy with gestational diabetes and postpartum depression. So women who are pregnant should also do 150 minutes per week of moderate intensity exercise during pregnancy. And in those who were very active prior to pregnancy, who habitually did vigorous intensity activities, running and such, it is safe to continue that during pregnancy and in the postpartum period. Talk to your obstetrician regarding the specifics, but it is safe to continue during pregnancy. For the youngsters, preschool age 3 to 5, they say you should be physically active throughout the day to enhance growth and development and teach important motor skills. And us as caregivers should encourage active play and a variety of types of activities. They don't have a very good quantitative amount of how much exercise a 3-year-old should get, but they say that a reasonable target may be about 3 hours per day, which they found was the average amount observed in this age group. So that's kind of the rough recommendation that they make for preschool age children. And then a little bit older kids from 6 to 17 and school aged should participate in activities that are age appropriate, enjoyable, and that are varied. So they recommend 60 minutes or more of moderate to vigorous physical activity every day. And most of this should be vigorous exercise 3 days a week. They recommend muscle and bone strengthening exercises 3 days a week each to meet these recommendations. So they expect kids to be much more active, playing in sports, doing some bone strengthening, so weight-bearing activities, and muscle strengthening to really help develop the bones and growth. So, common question that we get, is it safe for me to start exercising? So if you've been completely sedentary previously and you're starting a brand new vigorous exercise program, or if you have any kind of medical conditions, including high blood pressure, diabetes, obesity, obviously any prior history of heart attacks or heart disease, these can increase your risk of vigorous exercise. And so you really should see your primary care doctor or cardiologist, if you have one, to help kind of determine the safety for you individually and your heart rate goals of exercise. If you have been completely sedentary, there is actually an increased risk of a cardiac event, of sudden cardiac death or heart attack, if you're jumping straight into strenuous exercise. So, you may hear stories of people who have cardiac arrest during a triathlon or during a marathon event. These things do happen. During this high intensity exercise, you are at higher risk of having a heart attack. That risk goes down the longer you're able to train and reduce your risk, increase your fitness, you reduce your risk. So if you're just starting out, that's why we do recommend seeing a healthcare professional and managing those risk factors and doing what's safe for you. So one way that we can do this, I do this in my office in Ventura, is we do a stress test. So we call it a supervised symptom-limited exercise treadmill stress test. We basically put you on a treadmill. It starts relatively slow, walking pace, but at a pretty steep incline. And then we have you monitored, and we gradually make it harder, higher and faster incline until you want to stop. And that tells us a lot of things about your fitness. We look for evidence of any kind of coronary blockages or heart disease. We can see if there's any dangerous rhythms that occur during exercise. We monitor your heart rate and blood pressure and make sure that those are increasing appropriately with exercise, but not too much. And then we can see your maximum heart rate during this test, which we'll discuss a little bit more in the second part of this. Yeah.
Is this something every older adult should have, or is this based on if you have symptoms? Because I was told that if everything looked stable, unless I had symptoms, I don't need to worry.
That's a very excellent question, and you're correct, actually. So if everything is stable and you're not planning on doing anything new, you haven't had any chest pain, we don't recommend undergoing a stress test because you're kind of looking for trouble, that there's a false positive. These tests aren't perfect, may end up leading to more testing down the line if we see something on there. So if you're doing fine, you're not having any symptoms, we don't necessarily recommend this. The difference in this case is if you're planning on starting a really intense new exercise program, then this can be actually helpful. So it's looking for a different purpose. It's looking to see if you're safe for this exercise program and see if there's any evidence of blockages
Like
in
if you're
an
going to-
effort that you haven't done previously.
Like if you're going to boot camp, one of those.
Right.
strenuous, Or,
Right.
I mean, if you're normally walking, that's not a big deal.
Right. If you're normally
Yeah.
walking, doing your regular activities, and you haven't had any problems, and you're planning on continuing those, then
Yeah.
we don't look for trouble. But this is something that they will do at the beginning of a cardiac rehab program, and as well at the end of the cardiac rehab to kind of assess your fitness and look for any of these issues. So if you do start exercising, obviously you want to watch out for any kind of red flag symptoms that could spell trouble and make me want to send you to the emergency department. So chest pain or chest pressure that happens with exercise and resolves with rest, especially if it goes to the jaw, or it can go to the back, you can go to the left arm. Women tend to present sometimes a little bit differently in terms of their angina, their chest pain. But any kind of concerning symptoms that happens with exercise, even if it doesn't meet the textbook definition, I would talk to a healthcare provider or seek emergency department care. If you have shortness of breath or racing heart, obviously with exercise you're going to have a higher respiratory rate and heart rate, but something out of proportion or worsening. Sudden back pain. Any kind of lightheadedness, dizziness, or passing out with exercise is not normal. So any of those three things, if they're happening during exercise, you should be concerned or come see us. Okay. So that's essentially it for the physical activity guidelines part. I'm going to talk a little bit about exercising with heart rate and give you some specific heart rate goals to go back to those guidelines and see what a moderate intensity exercise or a vigorous intensity exercise may be for you. So whether you're an athlete, a professional or amateur athlete, just trying to stay active, or if you have a heart condition and you're trying to limit yourself and keep you in a safe range, heart rate monitoring during exercise can be helpful. So there are a lot of different devices that are out there these days. This is kind of where the disclosure in the beginning came from. So there are some that are worn on the wrist, and these measure your heart rate based on the variation of your blood flow to the tissue. So it shines a light there, it reads back the reflected light, and there's variations in the reflected light that goes along with your pulse rate. So this is generally good at rest if your heart rate is slow, but in my opinion there's lower accuracy with exercise because there's movement, your heart rate gets a lot faster, and it's also less accurate if you have something called atrial fibrillation, or you're having irregular heartbeats where the pulse in the skin may not actually match up with the electric heart rate of your heart in atrial fibrillation. So these can range from a thin strap that has very basic functionality, just kind of heart rate and maybe the number of steps that you've taken in the day, to full watches with GPS tracking, has fitness apps on the watch that can track you, and obviously with the increased functionality is going to be an increase in price. So it kind of depends on what you're going for, how much you're going to use it. So those are some of the examples of some of the products that are out there. So these are all on the wrist with the Apple Watch, the Fitbit counting the steps, but they have a number of other products. Something called Whoop also looks at heart rate variability. Garmin Polar and Timex and a number of others have wrist-based watches with heart rate monitors. For something a little more serious, a little bit more accurate during exercise, there are chest straps that go around right over the heart and actually measure the electrical activity of the heart. So these tend to be more accurate, especially during exercise at higher heart rates. And with atrial fibrillation, it'll actually pick up the electrical rate and report that. These tend to be pretty accurate. These are 3 of them. There are others as well, but some have a connection called ANT+, which interacts with some of the monitors, especially the Garmin devices. But the other ones, a lot of them have Bluetooth capability as well. So they'll actually connect directly to your iPhone or Android phone with Bluetooth, and then can link into a number of the apps that can help track your heart rate and everything. And then there's some newer devices now that can actually give you an EKG. So those other ones just gave you a heart rate. There are a few out now that will actually give you a 1-lead EKG from your left to your right hands. So one of them is the AliveCor Cardia Mobile. So this is a separate little tab about the size of this with 2 electrodes on it, and you stick your thumbs, your left and right thumbs on the electrode, and it gives you an electrical signal between those, measuring the electrical activity of your heart. And it matches up with your phone, and then you can record that 10-second strip, save it, you can send it to your physician, or store it. A same company has a device with the Apple Watch. So this is called the Cardia Band. So instead of having a separate thing that you put your left and right fingers on, you have the watch that has 1 electrode on the wrist, and then the second one, you put your finger or thumb from your other hand on that one. So that completes the circuit and gives you that same 1-lead EKG. This is with the initial series of the Apple Watches. The newest Apple Watch, the Series 4, has this basically built in. So the watch itself is 1 lead, and then with your other finger, you touch the crown on that completes the circuit, and then that can give you that 1-lead EKG. So they've been, the company and Johnson & Johnson have been doing some testing on these. One of the big studies came out at ACC in March, where they looked at some of the accuracy of the Apple Watch Series 1 through 3 in terms of detecting atrial fibrillation. And it was in a very general population. There weren't very many people who were older or who had risk factors for atrial fibrillation, so the actual detection rate for AFib was very low because there weren't that many people that had it. But they're doing a follow-up study in people who are, I believe, 65 or older, and with the Apple Series 4 watch, and that will they'll be enrolling that, not yet, but sometime soon, and they'll be looking for actual clinical results to see if detecting AFib with these watches will benefit people, reduce strokes and things down the line. So we don't know a lot about this in terms of how beneficial it is to the individual. We know that we can detect some things. Some things may not be clinically relevant, but any findings I would confirm with a physician before you get yourself too worked up about them. Okay. Any questions before you go on?
What's your experience with that particular watch? I mean, do you agree with it? Do you think it's a good thing, or?
With
The Apple Watch?
with the Apple Watch, with getting the 1-lead EKGs.
Live text with pictures?
I've gotten a couple new consults from it, with people just seeing that their heart rate is high and they don't know if that's normal for them or not. The atrial fibrillation actually was pretty good. There was a patient of mine who had the watch. He'd had AFib in the past, but we thought that he was gone. He had felt some palpitations. He'd gotten an EKG of himself during it, and he was able to bring that in, and it saved him a monitor. Normally, I would put on a 1 or 2 week monitor for him, which is a patch that kind of goes on the chest and gives you a similar 1 lead EKG. And he pulled out his phone and he showed me his Apple strips, and I was like, I mean, that's AFib. I don't need another test to diagnose it. So it can be helpful, but I think that any findings in these newer technologies should be verified before we act on them. So, and that's sort of built into their study. Is in the first study, the one that just came out at ACC, any sort of findings, they sent one of these monitors to monitor for a week to actually verify it. So they didn't just go off of the watch. So, all right. So if we're looking at heart rate during exercise or at rest or at any other time, we have to know that it is affected by a number of other things. So your hydration level, the temperature outside, if you have a fever, caffeine, alcohol, sleep deprivation, your calories, or in extreme exercise, you're depleting your glycogen stores, a bunch of medications, including over-the-counter cold medications or a lot of blood pressure medications, and then anxiety, anemia, all of these things will affect your heart rate. So we look at trends, and you have to kind of look at everything in context of what else is going on with your body at the time. So a couple definitions, kind of like we started with. The maximum heart rate, or HR max, is the fastest rate that your heart would be able to beat in normal sinus rhythm at maximal effort. So we measure heart rate in beats per minute, or BPM. So this will vary a lot between individuals. It's not really a measure of fitness, that absolute number. It's just sort of set by your body and your heart. That's how fast it can go. So exercise at this rate is not sustainable. You will not be able to keep that up for any amount of length of time, less than a minute. And this really shouldn't be a target rate for any kind of normal exercise. This is the absolute peak. And there are some equations, formulas that try to estimate this number for people. The one that is most commonly known is 220 minus your age. But there are a number of other ones that are have some more factors, 0.7 times your age. This one has two different equations for women and men. And this was a study looking at their equation on the dotted line versus the 220 minus your age on the solid line. But if you look at these graphs, no matter which equation you use, you notice there's a huge variability. Some people, a 50-year-old might have a heart rate max of 200 or a heart rate max of about 110. So it's such a huge range that number may not really be helpful. It's kind of what we go off of if we don't know what your maximum is. But if you're 65 years old and your heart rate gets up to 180, that may be normal for you. And so if you're exercising with heart rate, you kind of just have to figure out what your limits are and off of the relative intensity partly. The resting heart rate is the minimum heart rate that you get. This will also vary quite a bit between individuals, but it tends to be around 60 to 90 beats per minute. With increased exercise and increased fitness, this will actually drop. And so very highly trained athletes, their resting heart rates may be in the 50s, may go down to the 40s. Some of the Tour de France winners had heart rates in the 28 to 35 sort of range. And that was normal for them. So the range, the heart rate reserve, is just the difference between your resting heart rate and your maximum heart rate. And the maximum heart rate could be based on one of those formulas if you don't do a maximum exercise test, or or actually measured. So as an example, a 65-year-old male with a resting heart rate of 55, but unknown maximum heart rate. The gentleman hasn't, gone out and done a treadmill stress test or anything, so we don't know what the maximum is. So we'd have to calculate it. So we can calculate it using the 220 minus your age formula. So his maximum predicted heart rate would be 155 beats per minute, resting heart rate of 55, so that heart rate range or heart rate reserve would be 100 beats per minute. And I calculate this, put in this math because we'll use some of these numbers later when we're looking at the ranges for exercise. So this is the heart rate reserve. So looking at our, kind of what we were talking about before with moderate intensity exercise, the moderate intensity physical activity from a relative standpoint is somewhat hard, like we mentioned before, about a 5 to 6 out of 10 on your perceived exertion. And then the heart rate range from what we calculated before would be 40 to 59%. So about 40 to 60% of that heart rate range is the sweet spot. That's what we're going for a moderate intensity activity. Okay. If you just calculate it off of the maximum heart rate, then it'd be about 64 to 76% of that maximum heart rate. That sort of range is where we want to be for this moderate intensity exercise. For a vigorous intensity, then again, the relative intensity is going to be hard, 7 to 10 on the perceived exertion. And the heart rate range now is going to be 60 to 90% of that heart rate range that we calculated on the last slide. Or if you just go off of your maximum heart rate, 77 to 95% of your maximum heart rate. Anything above that, above 95% of your maximum heart rate and above 90% of your heart rate range, that's really getting into the maximal effort that you would do on either on a treadmill test or on an interval, like a high intensity interval type of training where you're doing a short burst of very high effort. And try to reserve that for fairly highly trained athletes who are trying to benefit their peak output in that range. But otherwise, for the rest of us, we don't really go into that range in the heart rate very often. You get benefit actually primarily from an aerobic and endurance standpoint. You get benefit from that moderate intensity range. Okay. So we can calculate for an example individual on this one as well. We have a 60-year-old female. The maximum heart rate, she actually did a treadmill test. So we found her maximum was 145, and her resting is 65 beats per minute. So for heart rate range, we were 65 to 145, so that range is going to be 80 beats per minute. That's kind of where her heart rate tends to be. And so for a moderate intensity activity, if we do our 40 to 60% of the heart rate range, that calculates out with those numbers of about 32 to 47 above the resting heart rate. And so we'd get a number of around 97 to 112 beats per minute is where she would want to keep her heart rate to do a brisk walk to get that benefit of a moderate intensity workout. She wanted to jog and get into the vigorous intensity workout. Then we calculated out 60 to 90% above resting, and we'd get up to a heart rate range of about 113 to 137 beats per minute. And we notice her max is 145, so for regular exercise, we really don't need to push it above 137. And for moderate intensity, we don't need to push it much above 112. You can also calculate these based on these percentages of the heart rate max from 64 to 76%, or 77 to 95% for moderate and vigorous. You see, the numbers are pretty similar. So these are all rough estimations. There's other formulas online that you can see, but they're all going to give you roughly the same numbers. And part of this is going to be your perceived exertion and sort of seeing how you're feeling. But for specifically looking at the numbers, we can use these as sort of some of the guidelines. Yeah.
If you get a person that's a decade older, say in the 70s,
Mhm.
then the intensity or the moderate intensity would be lower?
So with age, the maximum heart rate tends to drop. And so somebody who's 70, the heart rate max, if you use the 220 minus your age, would be 150. But on a treadmill, you might not actually get up to that at maximum, so you may only get to 140. So that maximum tends to decrease with age. And so that'll bring down these numbers a little bit. But again, everybody's going to be a little bit different. But getting your heart rate up into the 90s to 100s will generally work for someone around that age to get into the moderate intensity. Yeah. So for athletes, you can split it up into some more zones to get a little bit more nuanced and a little bit more assistance with training exercise. So another way to break it up, and this can be found online, is into 5 zones, again based on either your heart rate max or your reserve. And each zone is going to provide different benefits to the body. So the type of fuel that you use during that exercise, the duration of the effort that you can sustain, and you'll get different benefits in terms of your fitness goals with these zones. So if you're training with heart rate for the first time, start low and increase gradually to kind of determine your own efforts, your own levels, and avoid injury. So these are the 5 zones that break it up, and you see it's kind of similar to the moderate intensity and vigorous that we talked about already. The moderate intensity on the previous would be in the lower range down here, and for these you really get a benefit in endurance in the moderate intensity exercise. For an athlete, it helps with recovery if you're staying down at that level. But it also helps with weight loss. You're burning a lot of fat when you're exercising at that level. What this feels like, you should be fairly comfortable. Breathing easily, pretty low muscle load. You may be sweating a little bit. And this should be for basic training or for longer exercises. As you get into the higher heart rates in terms of your range, 70 to 80% or 80 to 90% of your heart rate max, so those are in the vigorous intensity, then you're starting to get into improving your performance capacity. You'll get muscle fatigue, you'll break down muscle, you'll build stronger muscle. And what this feels like is you'll get some muscle fatigue, you'll be breathing harder, you'll be sweating more and more as you increase. And this should be for shorter types of exercises, or if you get into these higher amounts, these are those high intensity interval training types of exercises where you're really trying to maximize your sprinting, your maximum performance, but those are short bursts into those areas and not typically meant for a really long sustained effort. So as a trainer or as an athlete is sort of figuring out their exercise program, they'll have some efforts that are lower down, some high intensity intervals, and these will actually change throughout the training season as you get different benefits with different zones. So one thing that we can, in athletes, can calculate is something called their anaerobic or lactate threshold. So this is the level of exercise where the body kind of transitions from aerobic to anaerobic metabolism. This is similar to, the anaerobic threshold is similar to the lactate threshold, which is can be measured actually in an invasive way in a lab where the lactic acid starts to build up in significant amounts in the blood. So for endurance athletes, finding this level and calculating this can be informative and can help their training. So with this, at this effort, above that, you're not going to be able to maintain it for longer than about an hour, and that's kind of how we actually calculate that. But efforts below this anaerobic threshold, and you'll have aerobic metabolism, you can sustain it for a much longer period of time. So that's why endurance athletes want to know where this is, because they want to know what level can they go just below that to keep going for 2 or 3 hours. Whereas above that, they know that they're going to be limiting themselves. The lactic acid is going to be building up. So it's an important training period or training thing.
When lactic acid builds up.
Muscles get fatigued, you get burning in your muscles, you feel it, and you won't be able to sustain it.
Continue.
Yeah. Your body will get rid of it after you stop exercising.
Muscle cramps? I mean, I've seen
can.
athletes or playing tennis for hours, they get muscle cramps.
Absolutely, yeah. So that's partly lactic acid, partly electrolyte and fuel depletion that leads to muscle cramps, yeah. So the most accurate way for an athlete to determine this is actually in a lab, doing what we call a cardiopulmonary exercise test, where we're measuring the oxygen and CO2 that's coming in and out. In an invasive lab, they can actually measure lactate blood levels as well, and then they push themselves basically to the limit, and we figure out when that is. Don't necessarily recommend this for you, but if you want to find your anaerobic threshold and you don't have access to an exercise lab, then we can do basically a time trial out on the road or somewhere safe. So don't eat or consume caffeine, because obviously caffeine is going to increase your heart rate. For at least 3 hours, make sure you're well hydrated. Do a nice low intensity warm up for 10 minutes, and then you either run or cycle at a maximum pace that you can maintain. And the goal is to get the maximum pace that you can do for 30 minutes. You take the last 20 minutes of that effort, either with hitting a lap button on your watch or device. You get an average of that last 20 minutes of that maximal effort, and the heart rate that you averaged over that effort is an approximation of your anaerobic threshold heart rate. So you'd figure out, if I stay below that, I'll be able to go for a long time. If I go above that, I'm limited to about 30 to 60 minutes before I'll have to stop. Okay? So tracking your progress, there's, in addition to a large number of devices, there's a large number of websites online or in apps that you can upload your activities. You can define your heart rate zones, the 5 heart rate zones, kind of set your own goals and monitor your progress. Some of these will actually have a social media type of component, so you can follow people, you can have friends on the apps. Some even have professional athletes that you can follow. You can like their activities, you can comment on their activities, give them motivation, ask them how the ride was, that kind of stuff. And these are some of the websites that are available for doing that. So I think they keep adding more, but those are the ones that I could find. I think this can really help in terms of motivation, that if you're putting it out there, and people are giving you kudos or likes, then it makes you want to do it more, and you can really monitor your progress. And some of these have analytic components that can see how your fitness is progressing and kind of give you some more numbers to go off of. So, in conclusion, monitoring heart rate can help you increase your fitness, or if you have heart disease or comorbidities, keep you in a controlled, safe zone for getting that aerobic benefit in the moderate intensity sort of zone. There's a number of different devices that are out there that can help you watch your heart rate and track it. and kind of depending on how much money you want to spend and sort of what features you want, there's advice that you can find for you. The online communities that I mentioned can give you opportunities to track your progress, reach some goals, and get some extra motivation, especially with the social component. But I would talk to either your primary doctor, your geriatrician, your cardiologist before starting a new vigorous intensity exercise program. So we can ask you about your family history, your medications, your other medical conditions, assess your own risk and make sure that you're safe to do that. So thank you very much. I'm happy to take any other questions if you have them.
How often do you go on the bike rides? Since I saw that long bike ride, seemed like a...
Yeah, this was fairly recent. This was on the 5th, I think, May 4th. I try to get out 2 or 3 days a week. Depends on what I'm doing on the weekend and if I'm on call. I can't get out on long rides if I have to get to the hospital within a half an hour. But I try to do 2 or 3 days a week of the longer rides like that. Yeah.
It's like a long ride, too.
That one was fun.
So what are the activities for people with heart disease or people that have back issues? What kinds of activities are best for them?
It's a really good question. So with heart disease, walking is generally safe for almost anyone. But like you mentioned, that can be significantly limiting in people, especially with arthritis, like knee or hip problems. Back issues may not be able to walk for a long period of time. So for those, I think indoors, either on a stationary exercise bike, recumbent ones maybe have less pressure on the back, and it doesn't have the weight bearing, but those might be better. Yeah, any kind of activity like that is going to be good for the heart. But for joints, I think that cycling or ellipticals are going to have less impact on the joints. And swimming is a fantastic exercise. So either doing laps or some of the water aerobics are, if people like that, are really good for getting exercise. You get resistance in the water because instead of air resistance, you're actually working against water resistance, which is much higher. And so you get that muscle strengthening component without any impact or pressure on the joints at all. So that can be a good option.
So you could get some aerobic benefit then from the water aerobics.
Mm-hmm.
Yeah.
Yeah, definitely.
Thank you, Doc.
All right. Thank you all for coming out.